Hi guys, Tom Morrison here, and are you always doing this in the gym? Are you always trying to get a pop or a click out of your lower back that just feels so good? You're like, click, oh, there we go, oh, lovely. If you start doing this all of the time and you start to crave this, or you find that in the middle of your training sessions that you're having to get down on the floor and having to do this, then you're going to be creating more instability in your lower back. Your lower back is going to hate you for that. You're going to fall into a vicious cycle of always feeling like you need to pop your lower back. So what you want to think about is everything upstream and everything downstream of the lower back. Leave your lower back alone. You'll mess it up. You'll mess it. So what we're going to look at is open up the hips, open up the upper back. So what Jenny's going to do is use an exercise called deep lunge rotations. She's going to set up in a push-up position, bring one foot up beside her hand, and then from there, she sees how close she can get her elbow down to the floor, beside her heel, keeping her shin vertical. Front leg is being opened up in flexion, back leg is being opened up in extension. You may not look like this. You may have your elbow halfway up your shin. You may need to have the back leg bent quite a bit, even bringing in a bit more, Jenny, so we'll look like a normal person's flexibility. And this is how you may look. Over time, you're looking to get as close to as Jenny as possible, so back leg as straight as possible, and that elbow down beside the floor on both sides, so that you're able to pass the deep lunge test on both sides. What you're going to do when you've done that, so test your hips, see how they are. If you're really like far up the shin, that's your problem. It's not your lower back. Your hips are just crazy tight. So from there, we're going to open up the upper back as well. So Jenny's going to reach up to the sky. She's going to push the hand that's on the floor in as hard as she can, and she's going to rotate through her upper back. Get a good stretch in the ribs, good stretch in the upper back, and then she just brings herself down. So this is what your reps are going to look like. You may find as you do this, that same pop comes in your lower back, but keep working on this, add it into all of your warm-ups, and it'll start to happen less and less, okay? So use this exercise in every warm-up that you do. It's a fantastic drill. Just keep swapping sides, do 5 or 10 reps each side. Over time, always be trying to get as close as you can to Jenny's demonstration, and you'll find that your lower back feels a lot better for it. Other things you want to consider as well is more plank work. So open up the hips, open up the upper back, and then start to work on your stability, work on your balance, work on your planks, and stop craving, stop moving your spine all of the time in that way, just with the lower back. So there's a lot more vertebra than just the couple in the lower back. The thoracic spine has a lot more. You have 12 in the thoracic and you only 5 in the lumbar. So you want to make sure that you are opening up the areas that need more mobility and creating stability where your body actually needs it, so that you stop craving that little pop. Okay guys?